Hello, everybody. For those of you who don't know me, my name is Peter Llewellyn. I run the services at MedCommsNetworking.com, which are intended for people across the global community of MedComms, by which I mean medical communications, medical education, and medical publishing. As part of those services, I run specifically a service at FirstMedCommsJob.com, which is for people who want to join MedComms, either as writers, account managers, and so on. You'll find lots and lots of resources at FirstMedCommsJob.com, all free, including careers guides, videos, meetings that are going on, and so on. Specifically with the careers guides, we have several careers guides, one of which is about life in account management. They're annual guides. The most recent issue came out in January, and my three guests today have all been featured in that careers guide. I've asked them to come online today and to follow, in fact, the webinar that we ran back in February. If anybody is interested in looking back at the original one, we ran that in February. You can find that on NetworkPharma TV. You can find it at FirstMedCommsJob.com. You can find it on the MedComms YouTube channel, all over the place, basically. But that meeting, we concentrated a bit more on how to get into the business. What I'm looking at today, or trying to look at today, is what do you actually do when you're in the business? So the brief today is talk about what's actually happening in our day-to-day work. Having said that, I'm going to start at the beginning, and I'm going to ask each of them to introduce themselves and give us, just paint a picture of how you got into the business, what your current role is, and the sort of agency environment you're working in. So on that note, I'm going in alphabetical order as always. So Ben, over to you first.
Hi everyone, my name's Ben Church. I've been at Oxford PharmaGenesis for just over a year now. I come from a psychology background at the University of Leicester. After I left uni, wasn't entirely sure exactly what I wanted to do. Happened to bump into a friend who was a medical writer at another agency, and she told me all about the world of medical communications. I thought it sounded really interesting, so I fired a few CVs off, heard back from Oxford PharmaGenesis, and the rest is very much history. So Oxford PharmaGenesis is an independent healthcare consultancy, and the independent bit is quite important because it is sort of, we're not owned by any of the companies, so it allows us to have a lot of autonomy over what we do. We've been around for just over 20 years now, grown from a few people to over 300 now. We've got a couple of offices in Oxford, got one in London, one in Cardiff, one in Cambridge, which is quite a relatively new one, which is expanding very quickly. And abroad, we have offices in Philadelphia, Melbourne, and Basel.
Just unmute myself. Thank you very much, Ben. I thought you were going to go a little bit more into what your background was and how you just paint that little bit of a picture. Sorry, and just give us a bit more detail on yourself and what.
So I've sort of I came from a psychology background at university. Got into as I said, wasn't entirely sure exactly what I wanted to do. But the more I found out about account management, the more I thought it suited my skills in communications. The variety in the work was really sort of widespread and broad, and it sounded like a really interesting career path for me.
Just very briefly, sorry, what qualifications did you have when you came in? I don't want to get bogged down in this, but what level were you at?
I came in with a BSc.
BSc,
from
okay,
University of Leicester, yeah.
Okay, cool. Thank you very much. Okay, who's next alphabetically? Alice is next.
Yep. Hi, I'm Alice Fantom. I'm an account exec at the Envision Pharma Group. So before I got into MedComms, I did a degree in biomedical science and then also a master's in biomedical science. So I was originally applying to lots of PhDs, and I thought this was the path I wanted to take. So as I got through my master's, I decided that research actually wasn't for me. But I knew that I wanted to continue to work with something that would allow me to use my scientific background, because I'd worked very hard to get there and get the qualifications. And I also needed something that was fast paced. So that sort of led me to account management and specifically MedComms. So again, like Ben, I fired off quite a few CVs and in particular applied for the project assistant role at Envision Pharma Group. So I was in that role for about a year and then was promoted after a year to the account exec, and I've been at Envision for 2 years now. So just to give a bit of background to Envision, so we're a MedComms agency, a global MedComms agency, and we specialise in strategy through technology and medical affairs. So we've got a few offices in the UK dotted around, so a couple down south, so we've got Horsham, Bishop Stortford, and then my office up north in Wilmslow. And then we also have a few offices in the US, Asia Pacific, so Australia and Japan, and Serbia as well.
Fantastic, thanks, Alice. So next on my list, as it were, of three is Charlotte.
Hi, yeah, so I'm Charlotte Lupton. I'm a senior scientific project leader at Helios Medical Communications. We're an independent global healthcare communications and strategic consultancy agency based in the UK. We currently have 2 offices in the UK, one down in Witney in Oxfordshire and one up in Alderley Park in Cheshire, which is where I'm currently based. So there's about 100 of us so far, and the company is about 5 years old, so we're relatively new in this space at the moment. With regard to my background, so similar to Alice, so I have my undergraduate, my bachelor's degree was in biomedical science from the University of Sheffield, and then I did a PhD in behavioural neuroscience at the Institute of Molecular and Cellular Biology in Singapore. So it was when I finished my PhD really that I knew I didn't want to run a lab and therefore stay in academia and continue with a postdoc. So when I returned to the UK, I spoke with some recruitment agencies and stumbled across MedComms really, and haven't looked back since. I've been with Helios now for a little over 4 years. So I started in the entry position as a scientific project coordinator, and I've loved it ever since.
Excellent, excellent. Thank you very much, all three of you. So a first point is we've got 3 quite different people, different backgrounds, different agencies, and hopefully as we have the discussion, people will get some insight into those sorts of the differences between you and the different ways you work and so on, which is important. Just to kick this off, I think we have to, at the moment we're talking in May 2020, so I don't want to get bogged down in the COVID-19 type stuff. But can we just run round? I'm going to go backwards if that's okay, Charlotte. Just paint us a picture. What's happened at your end? I guess you're all basically sent home. You're all working from home. How's that working?
Yeah, no, it's great. No, we're all working from home at present. Luckily, we're all quite on top of our IT and technology aspects, so it hasn't been too different. We're just doing a lot more Teams and a lot more Zooms calls to make sure that we all keep in touch. But with regard to work, it hasn't really changed too much. There's obviously a bigger focus now on digital and technological aspects. But to be honest, this was the way it was moving forwards for a small amount of time. So there's been some changes, obviously, from face-to-face to virtual formats. But if anything, it's great. I think everybody is widening their skill set and repertoires with regard to virtual meetings. So it's actually a really interesting era.
Excellent. Okay, and I'm going to flick around each of you, although to some extent I suspect you'll say the same sorts of things, but just give us a flavour from your own points of view and your own business point of view. So I'm going backwards to Alice. Go on, you next.
Yep. So very similar. We're all at home, all keeping in touch over Skype and regular status meetings more than usual, just because you don't have that coffee room chat and just regular catch up. So, but yeah, everyone's keeping in touch. We were all very well set up because people are used to working from home, and then obviously we travel on site quite a lot, so everyone had all their IT equipment set up. And then again, with regard to work, all of our face-to-face meetings are now switched to virtual. So there's been learnings and things in that just to get everything switched over, but it's been very interesting and everyone seems to have risen to the challenge and the clients are getting on board, so that's pretty exciting. And then so obviously publications are carrying on as normal, just with some authors being impacted by COVID obviously, but yeah, everything's great.
Okay, cool. That's very positive. Ben, have you got a similar positive story to say?
Yep, very similar. It's as close to sort of business as usual as we could expect. Everyone working from home at the moment, keeping in touch via Teams, not just for project stuff, but also just having those general catch-ups that you miss in the coffee room. We are making time to, keep that social aspect and keep everyone in touch with one another and feel like we're still working as a group and as a team. In terms of our clients, very similar. Obviously, all the face-to-face meetings have been cancelled, but we found that where maybe some things have been shut down, the budget's just been reallocated and we're getting as much, if not more, work in at the moment. And yeah, just expanding our digital repertoire, getting some really exciting projects going with virtual meetings and making videos and all that sort of thing. So yeah, it's as good as it could be at the moment.
Excellent. So just as a general point, because I think it's important, people are watching this and they need to have a, need to have the overview. There has been a range of sort of reactions and situations across the MedComms business. I mean, there are agencies that were very virtual, there are other agencies that were not so virtual. So people have had to struggle more or less along that spectrum. But people seem to have reacted well, and certainly that was the direction we were going, and I think a couple of you sort of said that. All three of you, I think, were saying, but just nod your head again, you were able to work remotely anyway, so this is sort of a step further on. But it is different. I mean, I still argue it's very different giving someone a laptop and saying you can dial in from home to do a bit of work versus the whole company going virtual. But we were definitely heading that direction. And overall, the MedComms business is still healthy, and I think that's and probably actually very busy at the moment, and no expectation that will change. So maybe we're lucky, or whatever, however you want to phrase that. But this business is still thriving through these times, and will continue to do so. That's an important message to get out there, and the working practices are adapting around it. So that's an important message to get out there. Just to touch on it, and I don't want to. The questions are coming. Are you still employing people? Are you all basically nodding your head at that? I mean, you're not individually responsible for that sort of thing, but you're aware that the companies are still looking and employing people. Have you got any sense of how people are, how well it's working in terms of training, mentoring, and so on? People, have there been changes on that front? Are you presumably people are having to do more and work harder, because it's not quite as simple as people just coming into a room. You've got to work at the whole thing. But as far as you're concerned, and just headlines here, but that's the sort of thing that's going on, is that you're investing in training and mentoring people at a distance, and that's working okay? Is everyone just going to nod their heads? And you've got any particular insights they want to share on that front?
You go, Charlotte.
Oh, thank you.
It looked like Charlotte wanted to say something there, so go on, Charlotte.
No, well, I've actually had, and Helios in general, have had a lot of experience with regard to new recruits, and also onboarding from a virtual perspective. So from my own experience, I've actually had 2 new line reports join since this situation, and in the last couple of weeks. So it's actually been really beneficial, because actually it helps you optimize the process internally, and actually there's a lot more alignment, there's a lot more methods to think about how we optimize it now, and then also create a resource that you can reuse later on. So we're actually recording a lot of our sessions and sending them out, and then we have like Q&As together. So it's been no problem from our perspective. And actually we have an interview this afternoon that's being hosted virtually. So I think, as you mentioned, that there is a big change, but there's also a need for everybody to adapt. And I just think it makes everyone a bit more resilient as well. And actually it's good practice for the future. So definitely recruiting from Helios and adapting to the situation.
You say the future because the assumption is things aren't going to go back to quite what they were. So we're going to have to adapt to this, aren't we, a little bit? What I'd like to do, rather than as I say, rather than getting bogged down in the process of coming in and so on, which there's a lot of other content up on the websites, and the video we did with you in February, which is there on FirstMedCommsJob and so on, went into a bit more detail. So let's sort of skip the process of getting in and the basics, and can I pin you down a little bit? I want to hear what you actually do on a day-to-day basis. Who's going to volunteer to go first? What I've asked you to do is come with some projects that you can talk a bit about, and can we just start with one of you taking the lead on that? Who wants to put their hand up and go with that one, or am I going to choose someone? There you go. Alice looks keen. Okay, right. We're going to go with you, Alice, and just see where it goes. But I don't want to put words in your mouth. I want to get a sense of the working life. That's what I'm really interested in today. Yeah. So Alice, describe a little bit what you're doing and put it in the context of a project or something.
Okay, that's fine. So I actually work across multiple projects at once. So this ranges, in normal terms, it would be like things like face-to-face meetings, like symposiums. It would be training materials for the clients and their teams, and then also publications as well. So I'm going to focus on a symposium. So I worked on a symposium last year when things were all going ahead as normal and we were all attending meetings on site. So my role in that was I worked alongside my scientific counterpart, and we're both equally as involved from the beginning. So I would attend a kickoff meeting with the client to sort of get a brief and what they wanted to do for that meeting. I feel like I haven't given any background on a symposium, so
just paint the picture a little bit, yeah, of what the project or what that means, yeah.
Yeah, so a satellite symposium is a medical meeting. So a client will host it at a congress, and the aim is to provide sort of it's an educational event around a particular therapy area or a disease area, normally related to sort of that client's project, but it's not product, but it's not promotional at all, so it's very educational. So we would attend on site to assist that meeting. So we'd attend a kick-off meeting to discuss what that symposium was going to look like, roles and responsibilities, so who was going to take on what from the client's perspective and ours perspective, and then also what they wanted included in that meeting and what type of content. So that really helps us build our SOW, which is our statement of work, which I would be in charge of. So that basically outlines everything in the project that we were going to support with, and then equates it to a budget, so the amount that we would charge for that work. And then that's basically the project Bible of everything that we would do. And then the client would obviously approve that, and then we'd move forward. And so then I would then be responsible for developing timelines for all of the content that we were doing and all of the deliverables pretty much up until the meeting. And then I would distribute that round to our client and also all of the teams that were working on the project. So our studio teams who are also involved, our scientific team, so everybody really. And then we'd kick off the project and it'd start. So when we're in the nitty-gritty of the project, so we just attend status meetings with the client, and I would do that with my scientific team, and they would probably be on a bi-weekly basis. I would be responsible for managing the finances of the project, so everything to do with sort of invoicing and reconciliations once the project was done, and then forecasting as well, so how much revenue we were going to bring in and resourcing. So that would carry on until the on-site. So the on-site meeting, we would travel to the location of the meeting, and we would support the client in the running of the meeting. So we'd get we'd sort of help, they'd have presenters, and we would assist with like slide previews and technical rehearsals and make sure everything was up and running and ready for the meeting to take place. And then in the actual meeting itself, my role would be very much making sure that everything was going to plan, and that everyone was doing what they should do and presenters were doing what they should do and at the right times, and make sure everyone was briefed. But yeah, I think that's probably a good summary of.
And just to finish off, Alice, there's some feedback coming from somewhere. Sorry, guys. Just to try and finish that off, Alice. There's the sort of whatever you call it in your agency. We used to call it post-mortem. I used to hate it, but at the end of the project, there's going to be some sort of review of what's happened.
A debrief.
A debrief is a better word.
Yeah. So we'd sit down with the client and post-mortem sounds awful.
This is a long time ago. That's just. I used to hate it.
So it's a debrief. So we'd run through everything that went well, things that could be improved, things that we could do better moving forward. And then in terms of finance perspective, we'd reconcile that project. So we'd go through and check that we'd done everything that was included in the statement of work, and then charge for how much we think we should.
Excellent. Okay, so and let's just pursue the meeting side of it for a moment then. So let's and Ben, Charlotte, you've got some comments on this. I mean, some of the important points there that I would pick up on are you've had to work with a lot of different sorts of people, including the presenters and people like the KOLs or whoever it is that's presenting at the meeting. I think that was the one bit that I thought was worth highlighting. Although that's more of a role for the content people, the scientific specialists and so on. But you're overseeing a team of quite a varied team of people,
mm-hmm.
and I guess project managing between a lot of different people with a lot of different agendas, sort of thing, and keeping them all on track, and that can be difficult,
Definitely. So we are in charge of keeping the client on track, the presenters, so the faculty on track, which is probably the most challenging part. They're very busy people. Most of them are doctors with real life patients. They're attending clinics. They probably don't want to be reviewing your slides or content. So getting them on board is quite challenging, but also interesting. And then also we have our internal team, so our scientific team, and then the studio team and the editorial team that are working on all of the content for the meeting and making sure everything is running.
Excellent. And also just pursuing, and we talked about satellite meetings, so you've got also, which is worth making a point of, a satellite meeting is part of a congress, which you said.
Yeah.
But that
exactly.
means there's a whole bunch of other people involved in determining a whole bunch of the rules as to how you're going to work, and potentially approving stuff or whatever. So there's another aspect to this, which wouldn't happen with a standalone meeting. Also, just to state the obvious, a satellite meeting or any sort of meeting happens on a particular day. And, you know, therefore deadlines become potentially very, very important.
Are hard deadlines, can't be missed. Everything needs to be ready for that date and needs to be approved so that we can present it, because the client is presenting things externally, so it has to go through quite a vigorous approval process and check that everything's on label for the product. So there's a lot of moving parts.
Exactly, which is important with quite a mixture of different sorts of people and agendas in there. That's one of the things I think is important to understand. So Ben, Charlotte, it looked like you were going to say something. So can I bring you in a little bit, talking around that sort of a project? Have you any other insights or observations around the sort of the challenges and enjoyment of running a satellite meeting?
Yeah, sure. So I think you touched upon a key point earlier that there is definitely a need to align across numerous stakeholders. So as you mentioned, there's the aspect of the client itself, and there's also numerous teams within the client organization. So it could be from a medical perspective, it could be from a commercial, legal, compliance perspective. So you need to make sure that they're aligned early on with regard to the classification of the meeting and the review and approval process, as Alice alluded to as well. If it is in conjunction with a congress or a satellite meeting, obviously you have to liaise with the congress organisers. So that might be the secretariat. They might have their own specific logistical or AV team as well. Quite often with congresses, there lots of different activities going on at any one time. So you also have to engage with other agencies and make sure you're aligned on the numerous activities and also the different content materials that perhaps might be on the exhibition booth. And then obviously, as you mentioned, internally as well, to make sure that there's alignment between the scientific team and the project lead team as well. So there are lots of teams that you need to make sure that you're aligned with regard to such an activity. And I think there's also the logistical aspect if it's a face-to-face meeting, but then there's obviously also aspects from a virtual perspective as well. And I think there are differences that you need to accommodate with regard to timelines. So it might be pre-recorded things, and you have to make sure that you're adapting your timelines and that you're flexible with regard to the final output as well. With regard to challenges, I do think that we are facing a few of those at the moment, particularly with regard to timeline. So I think a lot of congresses that were face-to-face or other meetings that were face-to-face that are going virtual, it obviously needs quite a quick turnaround time. And you definitely have to capitalize on your knowledge of how to run a face-to-face meeting to make sure that every aspect is covered from a virtual meeting perspective as well. We recently ran a virtual congress for a client, and it was their first one. So there were a lot of challenges there with regard to actually outlining the compliance and legal aspects with regard to permissions and review and approval process. So lots of things to consider there to be aligned both internally and externally as well.
Excellent. Okay, Ben, have you got a few words to say? And the bit that no one said anything about so far is running the event is fine, but you need some people, an audience, and you know, people filling those seats, sort of thing. And that's a whole area in itself, isn't it? To make sure you either fill your hall in the old days, as it were, or get the audience online, sort of thing. Ben, have you got a few more comments you can add to what the others two have said?
I think that was really nicely summarised by Charlotte and Alice. It's something that I haven't got a huge amount of experience in. I haven't worked on many big, the
satellite meetings. Then.
Satellite meeting, exactly. But no, it's from a accounts perspective. There is just so much liaising with congresses, internally, with clients, with authors. There's just always so much that needs to be done, and it always requires a really, really strong sort of plan and a plan of attack in the background, basically, to make sure that you have ticked all those boxes. And it's really crucial that you have those those timelines and that plan in place before you start.
Yeah, but okay, which is brilliant. And I think that gave a nice picture, but it also led very nicely, Ben, into the fact that you don't all do the same stuff, right? So Alice has been involved in big satellite meetings. You'll find a lot of agencies do big satellite meetings, or big and small meetings of all sorts. Ben, then that leads into you, because you've said you don't really do that sort of thing. So let's have a flavour of something a bit different that goes on within MedComms.
So very similar to Alice, I do work across multiple accounts, and they're really quite different accounts. So the first one I'm going to speak about briefly is a publications account, very much like the bread and butter of MedComms. So this is, we support with the writing of abstracts, posters, and manuscripts for our clients. We work with authors to write these manuscripts and eventually get them published or uploaded into a congress for presentation as a poster. So going into a little bit more detail, a lot of these studies normally we would organize all the author contracts, and we would get all the authors on board. Our client would come to us and obviously say the type of publications they want to bring forward. We would then get in contact with the authors, write up all the contracts for them, make sure they're happy to commit to the publication, and they know all the publication guidelines, which is really, really important, because that's something they need to follow very vigorously. We would then all come together, and we would do the organization for a meeting to get all those authors together, discuss the publications, write up those kickoff minutes and send them all out. And in the meantime, the thing that's going on in the background that I'm sure it's everyone's favorite thing to do is data vision, which is one of the main compliance programs that's used for tracking publications. And this is something at each stage of the publication, when you have contact with an author, or when you send a new draft of the manuscript or poster out, everything needs to be uploaded to this so it can be tracked, and we can make sure the guidelines are being followed. So as the process moves along, on the day-to-day side of things, it's a case of the accounts team communicating with the writing teams. We'll make timelines, we'll be discussing how the progress is coming along, if we need to speak to the clients about anything, if we need to speak to the authors about anything. And it's just a really big team effort to develop these publications. And then I think Alice might have mentioned it briefly, but there's the really vigorous review process. So at the end of each draft, we'll send the draft out for review, both with our clients and both with the authors. They'll come back to us with comments, and the writers within our team will incorporate those comments. And that's the process that gets followed until the end, until the final approval process. At which time it will get uploaded to, so products tend to start out as abstracts, which then get submitted to a congress, and they normally get accepted as a presentation, either oral or poster. We will then develop those oral or poster presentations. They'll be submitted to the congress. We'll organize the presentation, usually by one of our clients. We sometimes are on site for that. And then after that, the manuscript's usually following somewhere along in the background.
And I'm going to be a little bit whatever about this, Ben. That's great, and it's describing the process. I just want to draw this distinction a little bit more, if I can, between what you're doing and the writers, for instance. So, and just maybe tick off a couple of specific questions. And I shouldn't ask questions I don't know the answers to, but I'm going to do it, okay? But when, for instance, you highlighted data vision, I'm curious. Would you, as the account manager, be updating a data vision, or have you specialist data vision people, or the writers, whatever, would they be doing it? Just draw a little bit of distinction between who's actually doing what, and focus on what you're doing. Yeah?
Absolutely, yeah. The writers pretty much solely write the content, and they do have communications with the clients and the authors. That's something we do encourage at Oxford PharmaGenesis. But they're pretty much just writing the content in a publications-heavy account. Whereas the accounts team, we would be handling all the data vision. We'd be handling the bulk of the client liaison, definitely with the congresses if anything needs to be brought up. But then we'd be contacting them, and same with the authors for all the contracts and that sort of stuff. The accounts team are there to basically make sure everything's on track, on budget, everything's running smoothly, and everyone's sort of happy with what's going on. But the writers are solely the people that are writing the content in this case.
Okay, cool. That's interesting, because I will say, and I'm not going to dwell on data vision or anything else, but again, this is one of the things that people sort of have to understand. Different agencies are approaching this in very different sorts of ways, and other agencies will split that work differently. I suppose that's the only point to make there, sort of thing. So when people are talking to the agencies, and they've maybe the sort of guys watching this are talking to an agency about an account management type role, it's worth quizzing a little bit, and hopefully we're giving some insight into the possibilities there, and seeing what sort of work's involved and who else is part of the team. But pubs is a big part of this business. Charlotte, you're number 3. What are you going to come out with that's a little bit different?
Okay, so I'm quite lucky at Helios that I work across numerous different types of projects. So it could be advisory boards, workshops, symposia, standalone meetings, webcasts, disease education videos or slide decks, strategic support. So Ben and Alice gave great examples there. So perhaps I'll give an example of training materials. So quite often we support clients with aspects of internal training, and that might be, well, largely it's focused towards their local team, so medical science liaisons, for example. So what we would do there is we'd probably start off with our scientific team, and we would perhaps run an audit of what training materials that they already have in place and what they focus on. We would also review the training needs of the company, so that might be dependent on what products that they have and different activities that they have. We would align this with their strategic goals and the output of different congresses, for example, across the year. And then from a project lead perspective, we would focus heavily on the finances, as Alice alluded to. So we would generate the budgets, we would track the invoices, we would track the project as a whole to make sure that we were within scope of the project, and we would do all the reconciliation afterwards. We would develop the timelines for the specific milestones. So it might be that we have different modules that read out. They could be focused on disease education, background to a product, background to guidelines, for example, if it's a specific therapy area. And also internally, we'd have to make sure that we're resourced accordingly as well. So as both Ben and Alice alluded to, most people in MedComms work across numerous accounts or different projects. So you would need to make sure that you were aligned internally on, for example, the writer's capacity or the project lead that you're working with on any other projects that they had at that time. Quite often in MedComms, timelines change. So that's another thing that you need to adapt to as well, and make sure that if there is a delay, that doesn't then impact on another project, and that you have to resource accordingly as well. From my perspective as well, so I work across numerous products, but I'm also an account lead for several different clients as well. So I might be delivering a project specifically, or I might be overseeing other project leads who are delivering an activity, and then I'll have an oversight on that to make sure that there's consistency between the account, between the different project leads, and things like that.
Fantastic. So one thing we're all emphasising is you're all working on lots of different projects. I've lost people have obviously got that message, hopefully. Just out of interest, Alice, Charlotte, we talked a bit about the pubs with Ben. Have you got any comments from your points of view on that side of things? Alice, I mean, Envision does a lot of pubs work. Have you got anything to add to what Ben's already said?
So I'm fairly new to pubs. I've started working on an account that's got quite a lot of pubs, but like Ben, we're responsible for data vision and adding everything to that and keeping everything tracked. But I don't really think I've got anything else to add.
Okay, we should probably, for full disclosure here, admit, as it were, that Envision are responsible for data vision, and that's not we're not just talking about that just because of your being here, but data vision is pretty much the industry standard. So that's something that people will hear a lot about, whichever agency you're in with, sort of thing. Charlotte, I don't know actually. Does Helios do much pubs work, specifically pubs work?
Yeah, we do a lot of pub work across lots of different accounts. The accounts that I lead, we don't focus too much on publications, but yeah, as I mentioned, other accounts do. I actually find them a really interesting account to work on, because they're quite methodical, and it's quite nice. You have, as with a lot of MedComms projects, you know, you almost have this template of how you approach a project. And publications has a really interesting insight that obviously you've got different data readout of different studies, so you want to align your publication plan with your data readouts, but then also with your key congresses to make sure that the data that are published at that time are up and new and coming. And you obviously have things such as late breaking abstracts, which are new releases of data, but also putting that in with your strategic goals of the company is a really, really interesting insight. So publications, as Ben mentioned or alluded to, they're the bread and butter of MedComms, and they take in a lot of different skills and considerations from a company point of view. There's also obviously the compliance aspects with regard to embargo and things, lots of different levels.
And they can be quite fun, because they can be quite cutting edge, can't they? You're involved. And okay, so maybe the writers or the scientific specialists are doing more about the content, but again, the account managers are very much involved in the team and their timelines and process and so on. It can be quite fun being involved in that sort of cutting edge stuff. Just one thing that might be worth saying, you know, an event is probably, you know, in people's minds, that's straightforward. There's an event in 6 months' time, there's a deadline, we're working to it. With a publication, and maybe Ben, you were talking about publications, because, you know, when you start a publication, are you given 3 months, 6 months, 6 years? Do you know how long it's going to take to do a publication? Is there hard deadlines? Just give us a sense of that, because it is basically quite different, isn't it?
Yeah. In terms of abstracts and posters, you're normally targeting a specific congress, in which case there will be a hard deadline when you need to upload the abstracts.
For an abstract, yeah, okay, yeah. No, I get that, but I'm thinking more the manuscript, the peer-reviewed publication, as it were.
For manuscripts, not normally a hard deadline. We normally give our clients a rough deadline. It varies quite a lot depending on the manuscripts and depending on what type of data we're playing with as well. So yeah, anywhere between sort of 3 and 6 months, I would say is pretty standard.
But it can drag out from there for so many reasons.
Authors are incredibly busy people, and you never quite know what surprises are going to spring up when you're having a look at the data. So yeah, you need to be prepared and you need to be adaptable. The timelines can always change.
Yeah, but it's okay. So, but there's an important point in there again about how conference work and publications work is actually very much more integrated than it might sound when we're just talking about one or other. So that's worth bearing in mind. Charlotte, I'm going to ask a question, and the other two might want to comment on this. You know, how do you get the work in the first place? How involved are you on the account management side in just getting the work? Are you just salespeople? Are you not salespeople? Are there other salespeople? How does the work arrive magically on your desk? Because you've all started from the point where you're saying, we have a meeting to discuss the project. How does the project arrive?
So I would say, so there's a phrase within MedComms of business development. So that's where you liaise with your clients with regard to new activities, new scopes of work and things like that. I would say we're quite lucky at Helios. We work with a number of clients that we have really good working relationships with. So we've worked with them now. We've been in partnership with them for a number of years. So we have quite a good relationship. So I would say that actually for new works and new bits of projects that come in, it's organic growth. We don't really go after new pieces of work just because the relationship that we have and the outputs are in sync with the client and they like it. So they actually often refer us internally. So that's quite often what happens, and it can differ. You get different levels, I would say, of client experience of working with medical communication agencies as well. So we often work with the medical team quite a lot, who are quite dependent, I would say, on MedComms agencies, and we support them with a lot of different projects. But there may be other teams within a client team that maybe don't have as big budget to spend on a MedComms agency, or when they have it and they start working with us, it's very new for them and they don't know, I think, the scope of support that we can actually offer them. So it's everything from a project management point of view, you know, it's everything from monitoring the budget to liaising with the external experts that you want to engage with, to liaising with the Congress or other AV logistical agencies. So from a Helios perspective, it's normally through word of mouth within a client team, and often when they move to if they move to a new company, they recommend us. But there are lots of processes in place for first being able to work with specific clients. So quite often, you know, you need a services agreement in place, and you need to often go through a vetting process. So if a new project does come in, you're quite often asked to pitch for a certain project, where they will give you a brief for a project, and you would then develop a slide deck or another output of how you would approach that project, and the ideas, and also budget from that perspective. And they may have a couple of agencies that pitch for the same project. You may then present, and then they would choose then which agency that they wanted to go with.
Excellent. I guess, and that was great actually. And the other two are just nodding away. So I'm going to sort of take it, everyone's sort of agreeing. I think the point, I suppose the point, if there's a point I'm trying to make out of that is, you know, if the account manager from, I don't know, I can think of several companies who might ring up, you know, an account manager rings up, you know, you're going to get sold out sort of thing. Whereas in MedComms, you don't, it's not quite that sort of an environment. And an account manager in MedComms is not the salesperson as such, although this stuff doesn't happen magically. So everyone's, you know, everyone's open to opportunities, everyone's developing business, whatever. But you're, as an account manager, I'm just trying to cover that one question off. You know, as an account manager, you're not the salesperson who's just cold calling. That's not the idea. And in fairness, in most MedComms agencies, there's probably not that many account managers who just see their role in that sort of way. Although again, it's worth saying that the agencies are different. Yeah. So okay, I've got an eye on the clock as always, and I'm over my time again. So, but I think that I hope anyway that was great. Just getting painting a picture of what you're doing. So for the purpose of the video, what I'm going to do is wrap this up. What I'd like to do is wrap it up very briefly, if I may, because I've asked you all now to do this. If you just had one tip to throw out at an audience of people who might want to be account managers, who's going to go first? Alice, I'm going to go with you since you're unmuted. So you go first. Just a quick tip before we wrap it up.
Yep. So we have focused a bit on sort of challenges of the projects, but what I would say, we've also alluded to the teams that we work in. Everything is very much a team effort. So the challenges you face, you're not facing alone. So yeah, it's a very much team effort, and don't ever feel like once you're in there that you're meant to just go independently. Yeah.
Excellent. So you've got to be prepared for a team environment. You've got to be a team player, basically. If you like someone who likes working on your own, you're probably not going in the right direction. Okay, no, I'm going to go. Not sure which way I'm going now. Ben, I'm going to go to you. Have you got a quick tip you can throw everybody before we wrap up?
Sure. I think my main tip would be MedComms. One of the best things about it is its variety. So just embrace the variety of how much stuff there is to do as an account manager. It really is really broad. Don't just do the stuff you're really good at as well. Like put yourself out there for the things you're rubbish at, and it might be, you know, you might end up being amazing at them in the end. Just embrace the variety. Take as many opportunities that are given to you.
Excellent. Go on, Charlotte. You're going to wrap this up for us.
Okay. Oh, that's a lot of pressure. So I would give two tips if you're looking at an entry opening into MedComms. So one, I would say do your research. There's a really broad spectrum when it comes to different types of medical communication agencies. So some are purely medical education focused, but others will look at maybe legal, regulatory, advertising. So I'd say do some research about what area you want to go into. And particularly as an entry level, I would say tailor your experiences. So you will have limited or no MedComms experience. So what I would do is tailor the experiences or skill sets that you already have to adapt to the qualities that we're looking for from a project leader perspective. So that would be communication skills, ability to work in a team, organizational skills, attention to detail, which you might think is more content focused or writing focused, but actually you need to be on top of your project. So you need to know and be up to date on the latest correspondence and things like that. So I definitely say tailor your CV and go into an interview to utilize your skill set.
Excellent. And that in itself encompasses something else. I ask for one tip and you give me two. You over-deliver. Under-promise, over-deliver is the phrase, isn't it? But that's great. That's what we're all looking for. But thank you, guys. I think that was really interesting. I'm going to wrap the recording up now. I would just like to say on your behalf, well, on our behalf, thank you for joining us. But on your behalf, if anybody out there is watching this would like to contact you via LinkedIn, that's the easy way of doing it. We're all happy to hear from people, so thank you very much. For anyone watching this video, you'll find lots more videos like this over at one of several places. FirstMedCommsJob.com gives lots of information and videos like this for people wanting to get in the business. NetworkPharma TV is lots and lots more videos relevant to NetworkPharma TV. And MedCommsNetworking.com, which sort of overarches everything, is worth having a look at because there's lots of stuff going on for MedComms across the world. So please do join in. So on that note, I'm going to ask for our usual wave and then I'm going to stop the recording. So thank you very much, everybody. Have a good day. Cheers. Bye.